Good evening, class. My name is Elijah Matthews. Today, my group and I will be discussing some facts on Bolivia. In my group, there's Scotty Hine, Andrew Morris, Jordan Pugh, Rachel Van Stone, Kelsey Robinson. We chose Bolivia because it ranks at the bottom of Latin American countries, several areas of health and development. This includes poverty, education, fertility, malnutrition, mortality, and life expectancy. The population of our country is 10 million. The burden of disease is equally distributed between communicable and non-communicable diseases. Top causes of death in children are diarrheal diseases, respiratory diseases, and prenatal conditions. In adults, it's cardiovascular diseases, respiratory diseases, and injuries. Next, we will have Scotty Hine, and he will be discussing some other facts on Bolivia.
Diarrheal diseases are a major cause of death among children in Bolivia. Diarrhea-causing pathogens are transmitted through food, water, or feces. It is a very deadly disease because it quickly dehydrates infants. Bolivia has many characteristics that allow diarrheal diseases to flourish, such as crowded housing, unsafe drinking water, and poor hygiene. Simple improvements in these areas can prevent these diseases. A realistic strategy is to increase national policies and investments that support improved access to safe drinking water. This strategy worked in Ethiopia, where an NGO teamed up with local authorities to locate and improve areas with poor drinking water. Another preventative measure is distributing a rotavirus vaccination. The rotavirus is the leading cause of diarrheal diseases in children. Diarrheal diseases are highly preventable, and reducing the incidences of these diseases will significantly reduce DALYs and deaths in Bolivia.
We chose education because it will generally improve the quality of life in Bolivia.
An increase in education is almost always correlated with an increase in health through decreases in injuries, through knowledge, and then they can afford clean water, food, and better sanitation. There are huge disparities between the literacy levels and overall education in Bolivia, in the rural and urban areas, in girls, and in income levels.
23% of the GDP goes to education, but most of it all goes to private schools and universities. The money is there, we just need to distribute it to rural areas, girls, and lower income levels.
If we can work on benefiting everyone, we can increase education for girls' public schools and those with lower income.
On an increase in education, it will decrease types of mortality through knowledge on how to prevent diseases, like washing your hands.
Knowing about proper sanitation and hygiene can decrease risk for many types of diseases. 47% of diarrheal diseases can be prevented by simple hand washing. This is a very cost-effective preventative measure and can easily be attainable through proper education.
We plan to implement education by creating transportation from rural areas to locations where there are public schools that we created. Using a higher percentage of the GDP from the government for education towards public schools, this will increase the knowledge of the students everywhere.
We think this can be attained by promoting buses to schools so that the people from the rural areas can make it to the urban schools, or we can increase public schools in rural areas by creating a more central rural school and to promote urbanization in these areas.
We also want to promote volunteer teachers from Western countries, like Canada, to create projects abroad so that they can go into Bolivia and teach the students, as well as having Bolivians also teach the students.
Improving education and reducing these disparities in the Bolivian education is vital for decreasing the overall burden of disease.
Over half of the non-communicable disease deaths in Bolivia are due to diseases and cancers heavily associated with tobacco use. We think that if we are able to lower the prevalence of smoking, it would greatly improve the overall health status of the country.
According to Nation Master and World Bank statistics, Bolivia ranks in the 84th percentile of countries in accordance to cigarette consumption. With cigarette smoking being so common amongst adults, air pollution and lung diseases are in high expectancy. Also, according to the World Health Organization, 90% of rural households throughout Bolivia rely on biomass, which is basically burnable material for their cooking needs. Burning these materials inside the home causes respiratory illness, which causes devastating effects to the lungs and body. It is amongst the top 4 leading causes of death in developing countries. It is predominant in Bolivia.
Although similar laws are in place in Bolivia as there are in Canada, the compliance rating in Bolivia is much lower, meaning that these laws and regulations are not necessarily followed nor enforced. This level of compliance could be greatly improved by imposing fines and penalties, eventually resulting in a reduction in tobacco use and therefore the overall health status of the country.
A decrease in diarrheal diseases and tobacco use and an increase in education is undoubtedly the most important measures that need to be taken to decrease the burden of disease in Bolivia. In order to achieve this, we need your help.
Nice.